You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host, Dr. Mohan. April is National Donate Life Month. And today I have two guests with me whose goal is to spread awareness about organ, eye, and tissue donation and honor those who have given their lives for that. Please help me welcome Kim Turner, registered nurse and director of critical care at Mosaic Life Care St. Joseph, and Karen Christians-Parham, a registered nurse and nursing special education specialist. Welcome both.
Thank you.
So before we get started, tell me how long you've been part of Mosaic's team, Kim.
Okay, it'll be 40 years next year.
My goodness.
I know. I started in 1985 as a tech while I was in nursing school. Graduated nursing school in 87. Worked on the floor, and in 88 went to ICU and been there ever since.
My God. I was born in 1985, so...
Makes me feel really old. Thank you.
Well, that was completely the intention. Karen, how about yourself?
Well, I'm right there with Kim. I started in 1985 as a nurse, and I worked med-surg because you weren't supposed to specialize when I got out of nursing school.
Right.
But it wasn't long, and I got the ICU bug, and so I think 87 is when I started working in the ICU. I'm a nurse educator now, but Kim and I spent many years on the night shift in ICU, and we loved it.
Yep, side by side.
Collectively, we have 80 years of Mosaic culture and history right here. So first of all, that is a amazing feat. That is something we don't see in our normal culture these days, that people are part of an organization for 40 years. So first of all, thank you for that.
Yeah.
And before we get started talking about our topic today, do you guys listen to any podcasts, Karen?
I do.
Which ones?
Do. Well, sorry guys, but I have to say I love those Kelsey brothers. Super funny. But I do listen to this one too, and I think it's good.
It's no Kelsey brothers.
I know, right. But it has good pieces that bring to the organization.
Yeah.
And you highlight different caregivers, and that's what I really like.
I appreciate that.
I've been here a while, and I like getting to meet new people.
Well, Kim is not technically new to you.
She's not. In fact, we worked together on a lot of projects. I bet. Had the privilege of getting to help her open her brand new ICU space.
Oh, look at that.
Floor.
It's not brand new anymore, is it?
It's not, but it's amazing.
It still has a brand new ICU smell to it.
It does.
It might be C. diff, who knows, Let's hope not.
I
Kim,
hope not.
I hope not either, exactly. Kim, what about you? Any podcasts you listen to?
Honestly, the only podcast, I've watched a couple of the Kelsey only because my siblings, we have a text group,
right,
and they'll send me one. Educational podcast,
all right,
care stuff. Otherwise, no.
Otherwise, hey, that's perfect. I feel like there's so much range out there. You can spend any time with any podcast in any capacity. So that's great, because we are hopefully the next on your listening list, right?
Yes.
So today, like I said, we're talking about organ donation. Obviously, it is a celebration of life, if you will, but it sometimes can carry a little bit of stigma with it as well. Sometimes people have little reservations about that. Do you have any experience with that kind of attitude, Kim?
I do, but what I see more often in the intensive care unit, when we are taking care of a donor patient, once a patient has become a donor, it actually helps the families process through the grief, and also brings them some joy out of all the trauma that they've experienced.
As much as you can, in that it helps closure, if you will.
It does help closure.
Yeah, excellent. And before we sort of talk about, how one can sort of get some more information, can you share some statistics on the number of potential people waiting for an organ donation?
Sure. So every 8 minutes, another person is added to the list needing an organ. And then every day, 16 people die on the actual transplant list waiting to receive an organ. And then one organ donor has the potential to save 8 lives.
Wow.
And then the literature is a little varying, but for the tissue and eye donors, they can save 75 to 100. They can help 75 to 100 people, just one single donor of tissue or eye.
That is amazing.
It is amazing.
The potential to save that many lives and the amount of people dying on the list there's a mismatch.
There is a mismatch.
Right?
Yeah.
So, but And Karen, you have a story to share about organ donation, someone that's close to you, near and dear?
I do. I'm a avid believer in organ and tissue donation, and I would be even though I do have this story to share with you. You talked about the stigma a little bit, and when my daughter was a teenager and she got her driver's license, we had a big discussion on, hey, you can be an organ donor just like Grandma got her organ. So she did that at age 16.
Wow.
And so there's that opportunity to talk about it early on. But what I'd love to share with you is the story of my mom. My mom wanted to be a nurse, actually, and she didn't. I did. And then also I've got 3 other siblings, and my sister is actually a surgeon. Shout out to her, because I know it's Doctor's Day coming up here to all of you who have that wonderful, amazing career. But for organ and tissue donation, my mom had a rare immune disease called primary biliary cirrhosis. And not much was known about it initially. She got it in the, I would say, kind of mid to late 70s. And if you do the research like my sister had, because that's her thing, even transplantation of livers, which is what my mother received, was kind of a scary thing initially. It took some doing to get that going. We worked through the Mayo system. My mom had always gone there for, and they're amazing for all of what I call unique illnesses, if you will. And because I was a new nurse, I went through a lot of the pre-testing and all of the stuff you have to go to even become a potential recipient of an organ donation. And so we waited. And they told us it would be a while to even get on the list. We had to be at a certain,
window, if you will.
Yeah, window in the illness itself. Pretty scary times. And it was actually during holiday season that Mom started carrying her beepers back then.
I remember those beeper days.
And,
I miss those beeper days.
It accidentally went off when we were all there at Christmas, and we thought, oh no, it's time. But what an awesome gift. But it's time.
And it's
we
Christmas.
Were kind of like, ooh. So my family is from north central Iowa. Winters were pretty rough. Not like here. I enjoy the winters here, but it was a pretty rough winter. And we found out, she called right away, and it was a false notification. And so it was like, oh my gosh.
Man.
So believe me, we celebrated that Christmas holiday a lot, and really shared in the love of all of us. And we went our own separate ways. We all live pretty much in different states, other than my brother lives pretty close to Mom and Dad in Iowa. And it was less than a week later we got the real phone call, and I was actually working night shift, and I needed to find somebody to come in so I could fly up to Rochester. And she got her transplant in December 30th, 1990. And it was a miracle.
Really?
Being a nurse, I love all of the medical pieces of it. And being an ICU nurse, I was amazed at pre-op, they had to set up 100 units of blood for this surgery. So thinking of that and the amount and all of that, and we were so excited that she didn't even need 20 units. It was like 12 units. And she came out and, of course, intubated and all of that stuff. And that to me wasn't frightening for me or my sister. She got that gift of life. And then you think the donor just went through the worst time of their life, and we're celebrating, Mom's life. So that was pretty amazing. But long story short, we were blessed. We got to have her an extra 32 years.
Wow.
She lived. She just passed away about a year ago. But, she was there for everything to speak of. And I have a smile on my face. It's not a sadness. It's a blessing. And I really believe that.
Wow. Thank you for that powerful story. 32 years from a liver transplant is no small achievement.
Yeah, and back then, especially.
I mean, if
I
they're
think she's even
12
one of the longest living.
Might be. I've never heard,
transplants.
because the comorbidities are another whole different ball of wax. But I mean, that's amazing.
awesome.
And you kind of touched upon it, which is a sad moment for someone else in their family, and a happy moment for someone else. And that's kind of humanity in a nutshell, isn't it? The continuum of our medical journey is not
Exactly.
a siloed experience. It's a continuum of a life force. And I think that's the whole essence of organ donation. It is a transference of life force. So someone can live from you or through you or your family member, and to continue their journey with your assistance. And I think there's that holistic feel to it if you take away the noise a little bit. And I think that's the stigma. Sometimes people can't see it when something horrible is happening to their life, a medical event, or their family members. But that's a downside of it, right? So thank you for sharing that. That's I'm getting a little emotional myself just listening to you, because I can see how passionate you are about this. So just to shift gears a little bit, how does organ donation look today at Mosaic, Kim?
Okay, so people have a choice on whether they want to be an organ donor. So in the ICU, as we get patients that have suffered a catastrophic injury, can be from an array of things, actually. Some patients have made the choice already, so their families don't have to make the choice on whether they become an organ donor. Others have not made the choice. So then there's a discussion with physicians, the medical team, and family to make decisions in the best interest of the patient. We are not a transplant center where we do organ transplantation, but we are a donor center where we have donor patients that provide organs and tissues, eyes, for donation.
Understood. So we don't do any surgeries here, but we tee them up to be done somewhere else.
Correct. So, yes, we wouldn't do the transplantation surgery here.
Okay. And does type of organ make a difference in this decision making, or is it all or none kind of discussion?
Typically, it's all or none.
Okay.
Patients either want to be, a donor, or they don't want to be a donor. And again, like I said, some have made that decision, and that's so much easier for families if they've made that decision for them, so they don't have to deliberate at a very difficult time.
On the driver's license and such, right?
Correct. So you can sign up at the DMV. There's also a website, and I'm going to have to look because I don't remember.
Oh,
what
don't
it
worry. We'll
is.
give that plug
Okay.
during the podcast.
Yeah, there is a website you can go to sign up. There's also some apps and stuff that you can do, but you can do it at the DMV. It's simply, and then your driver's license will reflect a heart on it.
Right. I'm an organ donor because that was a question asked during my Missouri license, and I was absolutely, it was a no-brainer for me.
Yeah.
But for a lot of people, it's not a no-brainer. It's a discussion worth having, like you mentioned, especially when they're so young. Do patients or who have their organ donation can they specify?
I am pretty darn positive you can pick and specify. I look specifically up liver because it's near and dear to my heart because of what Mom received. And there is so much information out there, but it's not pressuring. It's knowledge, and I think knowledge is power, and it takes away some of that fear.
Right.
I really do believe that.
Right, and I'm just reading here for those who are curious. The website is registerme.org, and it does have an iPhone app as well. And if you're registered in the National Donate Life Registry at donatelife.net, you are part of that as well. So these links will be provided to you during the podcast at the end. So if anybody is curious on how they can get some more information, these are the two resources. Kim, I've also seen or heard that people can do living donations. Is that something, people say, I've seen, my wife watches Grey's Anatomy and the resident, and she's, it's like on its 30th season now, but they said about an episode where like, I'll give my kidney to my dad, or something along those lines if it's a match. Is that something we still do?
Yes, it is. In fact, I try to be very active with Midwest Transplant Network and attend conferences. I go to their DTACs or just meetings to talk about how we as an organization can improve our processes around donation. And they have guest speakers always. It's one of the things I enjoy most about going. And there was a nurse on there that donated a kidney. That was something that she was very passionate about. So I, too, Karen, we could say we're willing to give a kidney and go through the process and the matching. And then if they found someone who needed that is a true possibility.
That is amazing, and that is true selflessness.
Yes, it is. Because she has a young family, small children.
That's the highest level of compassion I believe one can do for anybody, and it's thank you for sharing that. What can someone who's listening, what can they do to support organ donation besides checking themselves as an organ donor on their license or going to registerme.org?
If you're a caregiver here at Mosaic, whether you work in Albany or Maryville or here on the St. Joseph campus, we have got a terrific committee. I know everybody says, "Ooh, committees," but
death by committees is a thing.
I know, right? But our organ and tissue and eye committee, it's all about donation, and it meets monthly, and we encourage caregivers of all areas, if they're interested in joining that committee. I just think it's quite wonderful. And we have a celebration of life coming up to represent this actual month coming up of April and Donate Life. So there's opportunities here if you're interested. Look for me, look for Kim. We're here most days, and we'd be happy to share with you that information.
Thank you for that. You mentioned there's a celebration on date, is that right?
There is. There's one coming up. Kim, do you want to kind of share what we have planned from our committee?
Lots of things going on. So Spirit Week we have, it actually starts the 6th, which is on a weekend. So we'll start April 8th here, and all week long we'll be doing celebrations. We're going to have some rock painting in the cafeteria there on the island, and people can paint on a rock, and then we're going to put it out front. Like a message. We're going to write little messages too on notepads and put them outside the cafeteria as caregivers enter, and they're just words for hope.
Hope and gratitude.
Yep, hope and gratitude. We have a celebration of life. We're going to do a flag raising. So the whole week is full of activities, and then Friday is Green and Blue Day.
To support organ donation?
Yeah, to support organ donation. So lots of activities going on.
I remember when I first came to Mosaic, within my first week, there was something called an honor walk. Can you talk about that a little bit?
Oh, it's beautiful. Kim is much more aware of it, but I got to share in that too because I'm on the committee. And what that does, when there's organ donation, there are several stages to the process. And the first part, and once the, approval, if you want to say, moves forward, and we find recipients, we don't personally do that, but the Midwest Transplant Group, when they get the recipients lined up, then the person who is donating their organs, life, if you will, as they move towards the operating room is where we have what we call an honor walk. And so it is called out various ways, overhead or through messaging, that if you want to support this individual who's given this most beautiful gift ever, we line the hallways, and often it's one of our chaplains who leads the procession with a prayer, and then it's just a moment of silence to honor that particular individual and family.
Yeah, and I was part of that, and I can tell you it was one of the most powerful moments I've encountered in healthcare at Mosaic, because hundreds showed up.
Yes.
And it was, people were just, and family was with the patient who gave the honor walk, and they were proud, they were obviously sad, but it was such a nuanced feeling, and everybody could feel it, and it renewed the spirit in a way I think very few times happen in someone's medical career. So it's a beautiful celebration, and I'm glad it's a part of our ongoing sort of compassionate care that we provide at Mosaic. So I want to first of all thank you both for coming and talking about personal and something that's very near and dear to you all for various reasons. And I can tell you it's a great committee to be a part of. And I'm an organ donor, and if anybody's interested, please consider being an organ donor yourself. It is the truest, highest form of compassion one can give to a stranger, to humanity. So I want to thank once again Kim Turner and Karen Christians-Parham for sharing this amazing time with us. Any last words of wisdom for our guests and listeners out there? Donate your organs.
Yes, learn more about it. Like, don't do it uninformed. Make an informed decision. I think it's important when we sign up for something, we know what we're signing up for. We certainly don't want somebody signing up that doesn't feel right in their heart.
Right.
And have the conversation with your family. I think that's one of the most difficult things. People make decisions all the time, but their loved ones don't know and aren't part of that. Mm-hmm. And the person in the bed doesn't know. It's the family that does the suffering and has the decision making. So that if we can make those decisions beforehand, it's so helpful.
Yes, and when you lose someone, I think you feel like they're going to be forgotten somehow. And I think this is just a beautiful way that their memory and life can live on.
I love that. Yep.
I love that as well.
Yeah.
Well, excellent. And to all our listeners out there, please, if you have any questions or concerns, Kim and Karen are always available, and we'll provide those links to you. And as always, take care, brush your hair.
Thanks for joining us for this episode of All the Pieces. Missed a podcast or interested in more information about any of our topics? Visit Connected to access the resources you need to be informed. Interested in having us cover a specific topic or giving us feedback? Send us an email at myepic@mymlc.com. We'd love to hear from you.